The only way to save American health care is to get patients in charge of the money, not third parties, like the government and large insurers. Two bills making their way through Congress will help that transformation. Hello, I'm Steve Forbes, and this is What's Ahead, where you get the insights you need to better navigate these turbulent times. Why do healthcare costs keep rising? Because, unlike other markets, the consumer, in this case the patient, is not in charge. Third parties are, primarily large insurance companies and Medicare and Medicaid. Most non-government policies come from employers. Health savings accounts, HSAs, which have been around for 20 years, permit patients to directly control certain funds rather than those third parties. Money can be contributed tax-free by individuals and employers. It grows tax-free in the HSA. Funds can be withdrawn tax-free to pay for qualifying medical expenses. HSAs are available only in conjunction with high-deductible health insurance plans. Today, there are 35 million HSAs covering over 65 million people. HSA accounts have $116 billion in assets. The advantage of an HSA, aside from being a great savings vehicle, is that you are in charge of how the money is spent. Let's say you need a prescription. You can compare prices offered by certain providers. The savings are yours, not the employer's. What you don't use in your HSA grows tax-free. When you leave this world, any funds in your HSA can be passed on to your heirs. The trouble with health savings accounts is that they are burdened with all sorts of restrictions that limit their popularity and potency. Two bills, the HSA Modernization Act and the Bipartisan HSA Improvement Act, are making their way through Congress that will remove some of these obstacles. For starters, the limits on how much that can be contributed each year to an HSA will be almost doubled. Under current law, contributions are capped at $3,850 for individuals and $7,750 for families. Those caps would rise to $7,500 for individuals and $15,000 for families. Among other things, the bills would allow people on Medicare who are still working to keep an HSA. Currently, they're being barred from doing so. Eligibility would also be expanded for veterans receiving care through the Veterans Administration, and Native Americans would have access as well. The bills would end the marriage penalty by permitting couples to combine their accounts. They would allow a person to keep an HSA even if their spouse is enrolled in a flexible spending arrangement. They can combine these spending arrangements into a health savings account. There are other improvements. These bills are very helpful, but much more needs to be done to really put the patient in the driver's seat in the healthcare market. HSA should be available to everybody, regardless of their other insurance arrangements. The contribution caps should be substantially expanded. People should be able to use HSAs to pay premiums for their own health insurance policy if they so desire. Any remaining restrictions on where and how people get medical services should go by the boards. I'm Steve Forbes. Thanks for listening. Do send in your comments and suggestions. I look forward to being with you soon again.